Welcome to Caring Like Family, the cornerstone of our culture and the foundation of our exceptional patient experience at Saudi German Health. At SGH, we are proud to be a member of the Mayo Clinic Care Network. This partnership highlights our dedication to excellence and reinforces our patient-centered culture.
Organizational culture can be simply defined as how we do things when no one is looking. While policies and procedures provide a formal framework, it's our culture that guides our daily decisions and interactions, especially in moments when we must act independently. Culture manifests in both visible ways, like communication styles and physical environment, and invisible forces such as underlying assumptions, unwritten rules, and deeply held values. In healthcare, culture directly impacts trust and patient outcomes. When staff consistently demonstrate caring behaviors, patients feel more confident in their care. When teams communicate openly, families trust the process. And when everyone feels welcome to share, concerns come up sooner and build trust among patients, families, and care teams, ultimately strengthening trust across all relationships. Research demonstrates this impact with compelling evidence. Positive organizational cultures lead to increased revenue, higher profitability rates, and significantly higher employee engagement levels. And specifically in the healthcare industry, strong cultures result in reduced mortality rates, fewer infections, higher patient satisfaction, empoweringly, and patients feeling empowered to raise concerns when needed. Additionally, a systematic review found that positive organizational culture, climate, and politics were consistently associated with nurses' happiness and joy at the workplace and lower levels of work-related stress. At Saudi German Health, our culture is deliberately shaped around our purpose of relieving suffering and providing family-like care to all we serve. This is why understanding and embodying our caring like family culture is so essential. At SGH, our caring like family culture extends to everyone we interact with. This care circle begins with ourselves and extends outward. First, we care for ourselves. Self-care and well-being are essential foundations of effective healthcare. We must maintain our physical and emotional health to provide the best care for others. Second, we care for our patients. We prioritize their needs with empathy and respect, providing personalized care that addresses individual concerns and makes patients feel heard, valued, and supported. Third, we care for patients' families. We support them in decision-making processes, provide clear information, and offer emotional support during stressful times. We recognize families as essential partners in patient care. Fourth, we care for our colleagues. We create a supportive, collaborative work environment where team members offer assistance and encouragement to one another. We respect diverse perspectives and expertise. Fifth, we care for our stakeholders, including providers and partners. We maintain strong relationships, ensure reliable communication, and work together to enhance patient care outcomes. Finally, we care for our community. We contribute to public health initiatives, participate in health education and prevention programs, and serve as a trusted healthcare resource for the broader community. This comprehensive approach to care ensures that we fulfill our purpose of positively impacting health and relieving suffering at every level, from individual well-being to community health. Where we'll explore SGH's CARE model, our practical framework for bringing the caring like family culture to life. The CARE model provides a practical framework with specific behaviors that bring our caring like family culture to life. Each letter in CARE represents a key behavioral component. C stands for connect, building trust through presence and empathy. A stands for assist, proactively supporting patients and colleagues. R stands for respect, honoring individual dignity and diversity. E stands for explain, communicating clearly and transparently. These behaviors, you'll be able to deliver care that truly feels like family, caring like family. Layla from the finance office is walking through the hospital lobby to deliver documents when she notices a mother with 2 kids looking confused with her discharge paper. No one is around to help. Even though it's not her job, Layla approaches and asks if she needs assistance. Learning she's trying to find the pharmacy for her medications, she personally guides her there instead of just pointing directions. At the pharmacy, she notices her struggling with the queue system while managing her children. Rather than leaving, she helps her take a number and ensures a staff member knows she needs extra support before continuing with her own task.
In healthcare, respect means honoring the dignity, preferences, and unique characteristics of each individual we encounter. The first key behavior is using respectful language. This means choosing words carefully, especially under stress. Respectful language includes addressing people with proper titles and using a calm, measured tone even in challenging situations. The second key behavior is honoring cultural differences. This means being mindful of traditions, languages, and sensitivities that may differ from your own. When you're unsure about cultural preferences, it's always appropriate to ask respectfully. For example, would you prefer a female healthcare provider for this procedure? Or, are there any cultural practices we should be aware of during your care? The third key behavior is maintaining confidentiality. This means protecting patients and colleagues and all stakeholders' privacy at all times. Confidentiality includes discussing patient information only in private areas, securing medical records appropriately, and sharing information only with those who have a legitimate need to know.